big picture. Okay, so mental mapping. Mental mapping is a big key of complicated scenes, because when you understand how your potentiality lays out in a framework, it gives you the capacity to work within the framework and make decisions based on what's needed. Okay? Now, when we teach this process, we teach it incredibly linear, okay, because it is. It screws people up because it's bringing you through a process of specifics. And then once you understand all the specifics and you get good at it, then you can start breaking the rules. But until you understand the whole mental map, we're going to say you're going to move through the whole thing linear, because people often forget where they left off in the mental map early on. So as we come into the mental map, I'm going to go big picture, and then we're going to go details into each of the items. So the big picture is what we call the patient assessment system. It's also shortened to the PAS. Now, in the patient assessment system, we have 4 parts. So the first part of it is what we call scene survey. The second part that we come into is what we call the primary survey. The third part is what we call the secondary survey. And then part 4 is the rescue plan. Now, scene survey, what's it all about? This is about observations, environmental conditions, and then finally, safety of the scene. Now, the primary survey, so once you get this taken care of, you go into the primary survey, and the goal of the primary survey is to find, stop, and fix life threats. Now, maybe the most difficult thing to recognize here is that if somebody has a broken leg, we're going to deal with that in the secondary survey. Okay? So they might be complaining of that, but unless something's wrong with their level of consciousness, meaning their ANO times 2 or less, something's wrong with their airway, something's wrong with their breathing, something's wrong with their circulation, those are the 3 things that kill people pretty quickly. And so we need to make sure that those things are secure. And if they're not, we stop and fix it before we move on to the next step. So hence we go through this primary survey. But they're still complaining about that broken leg. Broken leg ain't gonna kill them. But in the primary survey, you'll find out the stuff that will. Now, the secondary survey is this whole idea of baseline vitals, treatments, documentation, history, and trending. So vital signs are the communication from the inside of the body to the outside world to tell us what state people are in. We then apply treatments, and we continue to trend their vital signs to see if our treatments are working. We get patient history to understand the current illness or injury better, and then we document, and we're going to document all of that onto a SOAP note. And then the last thing here is the rescue plan. Now, with the rescue plan, it's pretty simple, which is that this is the transport decision. The transport decision is really straightforward from the standpoint that it's either going to be a self-rescue, it's going to be a assisted rescue where you're staying in place and you're having somebody come to you to get you out, or you're going to have a rendezvous where you're starting to move yourself out, and then you have somebody meet you partway in order to assist you the rest of the way. Okay? Now, basically, self-assist, or self-rescue rather, is ultimately based on the experience level of the individual, all day, every day. Meaning the more experience that individuals have, the more likely they are to self-rescue. Okay? And then the more impacting the injuries that we have, the more life-threatening, the more likely that we're going to bring in external resources in order to be able to transport that person out of the terrain. So that's our patient assessment system in the big picture. And so what we're going to do for about the next half hour is we're going to look at scene survey in detail.